Good afternoon. Thank you all so much for tuning in. If you're just joining the session, welcome. This is the piece on understanding the impact of workplace financial health programs and solutions, and we're so excited to get into it. My name is Miriam Freeman. I'm the program manager for financial health at the JPMorgan Chase Foundation. I've worked really closely with the Financial Solutions Lab team behind this report, along with WashU, and we're going to have a really great conversation, as well as see directly from the companies that were involved about some of the findings over this research that has taken place over the past couple of years. So just to give you all a little bit of background, the Financial Solutions Lab, in partnership with the Social Policy Institute at Washington University in St. Louis, conducted research with 5 Financial Solutions Lab alumni companies, and those are Brightside, HoneyBee, Manifest, MedPut, and Onward. They were all participants in the lab cohort focused on workplace financial health in 2019. And this research is focused on what works in fintech innovation for worker financial health. The Financial Solutions Lab is a $60 million 10-year initiative managed by the Financial Health Network in collaboration with founding partner JPMorgan Chase and with support from Prudential Financial. And this session is about showcasing results, and we're so excited to share the findings from these exploratory studies, which suggest that employer channel fintechs are in demand among employees, can be an effective tool for improving employee financial health, and can improve employee retention. So with that, I'll give Matt Despard, who's joining us from WashU, a chance to introduce himself and his role, and then we'll dive right in. Matt.
Thanks, Miriam. Hi, everyone. My name is Matt Despard. I'm a faculty director and visiting scholar at the Social Policy Institute at Washington University in St. Louis. And we were very pleased to partner with the Financial Health Network to complete these exploratory studies of these products and services. And we learned a lot and enjoyed working with the partners, and I look forward to sharing some of those high-level results with you today.
That's great. Thanks, Matt. So first, let's hear directly from the companies in a quick video, and then we'll get into a Q&A.
And Manifest, we're the easiest way for participants to consolidate their retirement accounts. Our work with Washington University and the Financial Health Network has been really important. Generally difficult to target demographics within a plan. Females, people that are younger, minorities. Manifest was able to increase their transfer rate and therefore maximize their retirement outcomes. By measuring our impact on a plan, we're able to build a case study that we can share with other large employers and grow our user base.
HoneyBee has a high-quality, holistic approach to financial health by providing our no-cost rainy day fund. With specific findings that we found from WashU, a quarter of our users say they would have used a payday loan if they didn't have HoneyBee, which is a clear indicator that HoneyBee provides a safer, more responsible, and sustainable solution to other alternative financial services or higher interest loan options. There's a lot of potential for fintech to make an enormous difference in reducing economic barriers to allow people of color to gain full access to financial health products.
MedPut is an employee benefit that makes every company's health plan even more powerful by paying for any out-of-pocket health expense for your employees upfront, and essentially converting any out-of-pocket cost into interest-free installments that an employee can pay seamlessly from their paycheck over time. The employer channel is a very powerful way to improve the financial health of the workforce. Nearly a third of employees that used MedPut actually used it to pay for a bill that was already overdue. And the majority of surveyed users said they were at high risk of putting off medical treatments if MedPut wasn't an option for them.
Brightside is a complete solution for employee financial care. Our financial assistants provide personalized help for employees with acute money issues, as well as assisting with medium and long-term planning. The most important outcome we saw in the research that we conducted with WashU was a dramatic reduction in employee turnover, which increased with additional engagement on behalf of the user. We learned that LMI individuals appear to be eager to engage with financial solutions. This is a population that's historically been underserved with financial advice and access to resources to help them with their finances.
Onward is a nonprofit fintech that seeks to help every worker build a financial cushion. While Onward was intentionally designed for low to moderate income workers, we noticed that workers across the income spectrum still struggle with financial security. There were a number of withdrawals from users' accounts, but for the purposes of medical emergencies and more often than we expected, overdrafts. So there's a product implication of, can we do more to make funds more readily available when people need them, or even proactively help folks avoid overdraft going forward.
So those are some great highlights, and I would encourage everyone to also check out the full report. There's a nice summary as well as individual reports on each of the companies and the specific findings. But let's discuss some of those high-level findings. So one of the main things that I think is very interesting is that it shows in the study that products and services being provided by these fintechs are mostly being used by financially vulnerable workers. So question for you, Matt, does that mean that using these products and services is causing people to be financially vulnerable?
No, it doesn't. That's a great question. What it does tell us is that these products and services are reaching the right people, reaching a group of, as you mentioned, financially vulnerable frontline workers in many of these companies. And that's significant because a lot of these workers don't necessarily have good access to affordable financial products and services. And financial inclusion, providing greater access really is well suited for the workplace because employers and fintech companies can work together to do things like leverage payroll systems to enable loan repayments and savings deposits.
Yeah, that's great. So that means that these companies are really doing exactly what they're supposed to be doing in their mission alignment and reaching the folks who they would intend to be reaching, which benefits the employers also, right? So I think that gets to one of the other big findings here, which is that this is really great news all across the board. And now we have some of the data to back it up, right? Can you share more about some of those impressive outcomes and some of your favorite tidbits from the study?
Sure. The findings really break out into three themes or buckets, if you will. The first one is that these products and services seem to help workers just better manage their cash flow needs so that they can meet their basic living expenses. And to give you an idea or an example, there were employees that were able to use loans to get caught up on medical bills or to repair things in their home that had been put off or repair an appliance. And so those are things that they ordinarily couldn't do just with their wages alone. And again, a lot of these workers don't have good access to affordable credit options. In helping them manage their cash flow and meet some of those essential needs, it seems to have helped them with immediate financial relief from the financial stress that they were experiencing. So a second key theme is that there's some evidence to suggest that many of these workers in using these products and services were able to avoid using some high-cost products in the marketplace, such as payday loans. A lot of the workers we studied had used payday loans in the past and were now using much more affordable products. And so that's really significant. And then the third theme or bucket is that in one study, we actually saw a link between use of the financial management platform and lower turnover, meaning that when we compared employees who used the platform with employees who didn't, turnover was lower in that group of employees who actually used the platform.
Those are really compelling findings. Thanks, Matt. And do you have any information on how some of those things have changed over the course of the COVID pandemic that we've all been living through? I think it was not intentional that you all were doing this research during that time period, but of course you were able to see some of the data before and after as well.
Yeah, certainly. We, midstream with these projects, we were in close communication with the partner companies about, gosh, what's going on? How are our workers affected? Fortunately, a lot of the workers remained employed throughout COVID, and but that doesn't mean that they weren't experiencing other difficulties. And I was really impressed by a couple of the companies who were more flexible with respect to loan repayment, and were just able to adapt their products and services kind of on the fly to help workers deal with whatever they were confronting during COVID. And in another study, we actually had somewhat of a surprising finding where we saw some savings actually increase a little bit during COVID. This was among a group of workers who remained employed, fortunately, and we suspect that it may have been because some of their living expenses had gone down a little bit. Perhaps they were receiving an economic relief payment through the federal government, and that gave them just a little more cushion to put some more money into savings, which was a really nice finding.
Yes, that's a wonderful, compelling example of how these types of services can be useful in good times and bad, and really adapt as necessary to the circumstances as well. So with that, my last question for you is for all of the HR professionals who are on the phone who may be thinking, this sounds like something I could use and have provided to employees at my company. Can you give us some tips on what this research suggests about what they should be looking for in terms of making those connections and choosing providers of services that are a good fit?
Yeah, absolutely. So let me start with, there are three things I think companies should look for in the financial wellness solutions themselves, the platforms and the apps that are available. One is, I think it's really critical that the app or platform be integrated and connected with the company's payroll system, that it has that functionality, just because payroll deducted loan payments and savings deposits are really critical, because the more automation that can be built into our financial behaviors, the better. It just reduces risks of workers defaulting on loans, and it can make savings automatic. Once it starts coming out of your paycheck, you forget about it, but you're building saving. So I think integrating and leveraging the power of payroll is huge. So that's the first one. The second one, I think the apps and platforms are useful not just when they enable access to a financial product like a loan or a savings account, but also giving workers some financial management tools. So ways where they can better understand their cash flow and say, oh, wow, I get paid on this day of the month, and these bills are due, at these times of the month. And just to be able to better visualize what's happening in their financial lives to help them make good decisions. And then I think the third thing that you would want to look for in a product or service would be access to real human beings. Not just, there's a lot of great things with digital financial services, but sometimes we run into difficulties in our financial lives where we need to talk to a real person. So access to financial coaches to help us and help workers deal with those trickier financial issues is really important. So then in terms of the companies, what to look for, I really think it's simple. There's just two things that I recommend we look for in one of these companies. One is that the company is truly dedicated in its mission to financial health, especially among frontline workers who have a lot going on in their lives. And then number two would be a company that is dedicated to evaluation, self-critique, and learning, meaning that they're always trying to figure out what's working, what's not, how can we make our product even better to meet the financial needs, again, especially of frontline workers, and versus companies that just push out a lot of untested marketing claims. So those would be the two things I would be looking for.
Thanks, Matt. That's super helpful. And it definitely ties into some of the other themes that we've heard throughout the day about the importance of behavioral economics and nudges and how all of that ties in to how people can manage their financial lives and how employers can best support them in making that journey as easy as possible and as seamless as possible, really. So with that, I think we are at our time to move to the next session and hear more about those broader frameworks exactly for what you're getting to, which is how best employers can evaluate what they should do next to provide employee financial health. So I want to thank you so much for taking the time in this session, as well as for all of your work on this research. It really is a rare opportunity to get this level of detailed insight into the impactful work that these companies have been providing, and want to acknowledge them as well, to, as your point, being open and transparent to learning throughout this journey and showing their impact so we can all collectively make use of it to advance employee financial health. Thank you.